In today's video, we look at diabetes. Want to know what goes wrong for someone to end up with diabetes mellitus. Want to know what are the causes of diabetes and what are those important life adjustments that one should make in order to live a healthy lifestyle even after the diagnosis. Hello everyone, welcome to my channel. Thank you for clicking. I'm Catherine Asimwe, a candidate of a Bachelor's of Medicine and Surgery, and I live in Uganda. Diabetes mellitus. What is this disease? So basically, diabetes mellitus is a disease that is due to a defect in that pathway from the time food is taken in to the time it's utilized by the body. And in particular, problems to do with diabetes come because the nutrients have failed to cross from blood into the cells, because at the end of the day, energy is formed from the cells. So when nutrients fail to cross from blood into the cells, or to where they are supposed to be stored, that's how we get diabetes. Just to explain this further, usually when we take in food of any kind, it can be carbs, it can be proteins, fats, vitamins, it will get into our digestive system. And usually what we take in are large molecules that are not soluble, they cannot be absorbed. So what the digestion does, it breaks them down into smaller molecules that can be absorbed. So now like the carbohydrates, you'll take in a particular cereal, you take it in, it's broken down into glucose, because glucose can be absorbed. So glucose will be absorbed from the gut into the bloodstream. On reaching the bloodstream, usually the body responds. It's like, oh, you know what? We have some glucose that has come around, which needs to get into cells to create energy. So the body summons the pancreas. We have an organ within our body called the pancreas. It attaches to the gut. So it summons the pancreas to release insulin. Insulin is a hormone. So this insulin will come, help cells to open up such that this glucose can get into cells where it gets metabolized, yes, further and creates energy. And in case the glucose is excess for the cells, some of the glucose will be redirected to the liver and it will be stored. Then some is below the skin. So what goes wrong in diabetes? In diabetes, either the pancreas, the cells responsible for producing insulin in the pancreas, they've been destroyed. So insulin is not being formed from the pancreas. Then the other problem may be because the insulin is being produced, but the cells are insensitive, like they are not responding. Even when insulin tries to activate them, they are not responding. Or sometimes even it's both. Insulin is not there, even the little that is being brought into the body, the cells are not responsive. Where we have someone being unable to form insulin, that's what we call type 1 diabetes. It's because the body attacks its own cells. You see, our body has some cells that are responsible for killing microbes, attacking foreign bodies. Now, there's times when the body can't recognize that these are my own cells or these are foreign. So it starts attacking its own cells. That's what happens in type 1 diabetes. What causes it? The cause in most cases actually is not clear. What you call idiopathic. However, in some cases, we think there is a strong genetic reasons. For example, we have some mutations in our genes. Deep down, you have genes, and in case they mutate, like they transform along the way, you'll find that they produce cells that will attack the body's own cells. But then also sometimes it's because of some viral infection. For example, during pregnancy, in case of congenital rubella syndrome, we've seen that most of these babies are born and then they tend to suffer from type 1 diabetes along the way. The other one, whereby the cells are available from the pancreas, they form the insulin has come into blood, and it has gone to the cells to make sure that, these cells should let glucose in, but the cells are not responding to insulin. That's what we call type 2 diabetes. It has a genetic predisposition and then environmental causes. So the reason why you point at genetics is because you could be exposed to the same factors with another individual, but then you get the diabetes and the other doesn't get it. Why? Because most likely you had the same environmental triggers, but one person had genetic predisposition and the other didn't have. So that's why we think in case you have any family member, like most cases first degree relatives, and first degree I mean your parent or your sibling or your child that has this diabetes, there are high chances that in case you get environmental factors, you're most likely going to acquire it. Usually the most common implicated environmental factor is obesity, and in most cases central obesity. Also, the other reason that has been implicated is that in case you're this infant, this baby who was born with a low birth weight, there is a kind of way the body tries to adjust, maximize storage. So there are high chances you may end up becoming obese along the way and acquire this disease. So now we have glucose levels accumulating in blood because they are not going anywhere. So we have them accumulating in blood and the body tries to respond. So usually it tends to excrete it. Like, okay, there's a lot of glucose, let's excrete it via urine. Start passing, usually it's sweet urine. No glucose, when it's getting out of the body, it doesn't go alone. So it goes along with water. That's the reason why you'll have to pass a lot of urine, large volumes of urine frequently. And in the long run, you get dehydrated. Water is the first sign of dehydration, usually thirst. Then also the cells, no energy. The body assumes you're hungry. So it will you'll have hunger. You want to eat. So the body gets yet that actually, it's not so that you're hungry, just glucose is stuck in blood. Sometimes when the body starts breaking down the fat to avail glucose, usually most likely going to lose weight. And the more the glucose accumulates, because for it's not the problem. The problem is in the uptake. So the more it accumulates, it gets converted into compounds that will cause blindness. There are compounds which come from glucose which get deposited in the eyes and cause blindness. There are those which occlude vessels. That's how you end up with kidney problems. Some compounds will damage nerves. That's how you stop feeling, like sensations get destroyed. Sometimes also compounds that accumulate in big vessels. That's how you end up with, for example, if the heart vessels that are affected, that's how you end up with diseases of the heart. It's what we call coronary artery disease. Part of your heart muscle will start dying off. There are chances of getting hypertension or high blood pressure. There are chances of vessels to the lower limbs getting affected and the limbs starts dying off. This urine in glucose, there are chances that UTIs start coming and they are recurrent. This loss of sensation in the limbs, there are chances that you won't have a wound, but you won't know even when you have it because you're unable even to feel pain. And remember, there's glucose in the blood. That wound has enough sugar. The microbes will come for the sugar, and there are chances that these ulcers will actually become so sick. Given that background, we want to know what are the life modifications to do, because not in everyone, all those things don't progress like that. If it's detected early and treated early, you're less likely to proceed into all those complications. So what needs to be done? We need to know the fact that diabetes is a chronic condition. So which means it will take a lifetime to treat it. So it's a good idea to attach to a particular diabetes clinic, where they'll keep reminding you of some of these things, and you get to access a team of various specialists that will help to even optimize care better and better. However, in this video, I'll try to bring out some of the important things, the must-dos that you should not forget. Pillars you should follow. One, to make sure that your sugars are controlled. What do I mean? It should be in the normal range, and there are measures to do, which I'm going to explain. Then you should also make sure that you know the self-management, self-evaluation. You do enough of self-evaluation, because there are things which you have to do as an individual. And then thirdly, there are those clinical evaluations whereby you have to move out to a qualified professional who will listen to you, judge on an individual level what the particular problem is. If tests are necessary, get them done. In case of any complication detected, treat it accordingly, starting with having glucose, the blood sugars in the normal range. There are measures that have been got to make sure that these sugars are kept in check. And I'll emphasize majorly 3 things. So one, I'll comment about diet, what you eat. Remember, we have excess glucose in blood. What are we looking at in diet? We want to see what is the right timing of feeding, what type of food is best for you, best quantity for you. So talking about timing, it's advisable that the timing should be regular. Breakfast, maybe lunch, supper, and consistently. And then the type of food, carbohydrates are good to use. Fats should be taken in low quantities, proteins, low quantities. A lot of fiber foods are encouraged. So talking about carbohydrates, you see these carbohydrates, they're rapidly absorbable and those that take longer to be absorbed. In your regular meals, it's advisable that we take these carbohydrates that are not rapidly absorbable. You know why? Remember, usually this is what you do. You'll check your blood glucose, take the shot, the insulin shot, and then have a meal. This insulin shot, most of this insulin takes some time before working, minutes before working. Whatever the carbohydrate you're taking, it should reach the body when insulin is available to work. You don't want rapidly absorbable carbohydrates. So starchy carbohydrates are encouraged because they have some bit of prolonged digestion and absorption is a bit slow. So starchy carbohydrates are good. For the other rapidly absorbable, they are good in having them as an antidote in case of hypoglycemia, because for that one you want to sort it so fast. So those sugar, because for them they keep causing fluctuations in glucose before even insulin is available to sort it, and in that way it's hard to keep glucose in the normal range. But if we have insulin available at the time when the food is absorbed, that means such glucose is easier to control. It won't keep shooting up because you already saw the problems with that high glucose that keeps shooting up and down. So quantity, talk about the plate method. We've met the plate method where they will talk about your plate should look like this. A half of it non-starchy vegetables, a quarter carbs, and then the other quarter like proteins. The other second pillar is exercising. Usually the role of exercise is that, utilization of insulin. Insulin is absorbed faster with exercise. However, this exercise should be taken with precaution because you know why? You have insulin working in your body. That means it's making glucose get absorbed like that. And we don't want blood glucose to go below a certain level. So if we encourage, insulin to work, then more and more glucose will be absorbed, and the chances that you will drop below the normal and land in hypoglycemia, which is very dangerous. So exercise is important, however, it should be taken with caution. Anytime you're going to exercise, take your blood sugar, make sure it's somewhere up, and along the exercising time, you have a snack or something, and just as an antidote. Talk about the medical therapy. So I understand that in type 1, you're most likely going to be managed by insulin because the problem is no insulin, and the only solution is getting insulin from outside. So that's why adherence to those insulin shots is very important. However, in type 2, it may not be insulin at the beginning. There are chances that you'll start with adjusting diet, exercising. If it fails, there are drugs available to help in, encouraging those cells to respond to estrogen. Things like metformin, things like glimepiride is only in case maybe you present at a time whereby even the pancreas has been affected and it's no longer adequately producing insulin that you'll be required to have the insulin shots. And it's individualized. So at this point, usually your physician will help you adjust accordingly. So basically these ones, all of them, they're helping blood to, insulin to get, they're helping glucose to get out of blood, and that way we are putting down, the glucose to the normal. So I'll move to self-management tips that you have to take on. One, you need to have a glucometer with you such that you keep, checking out these glucose levels, because you will need it here before the shot, you'll need it before exercising, and you'll need it to basically chart how you're progressing as far as glycemic control is concerned. Other than self-glucose monitoring, one of the other self-management tip is being able to recognize complications, because early detection of complications helps in early management and reducing adverse outcomes. What are some of the complications that we need to be aware of? Diabetes has 3 complications that occur so fast. Then it has some complications, 3 complications that affect the small vessels and end up affecting some particular organs. Then there are those that affect large vessels and affect major organs. One of the complications is that glucose may fall below normal. And what are the signs? You may feel nervous, you may get headache, weak, shaky, you may get feelings of a lot of hunger, you may get blurring of vision. There are some of the signs that show you glucose is lowering in blood. And what causes this? Usually it's because you've not taken enough food, maybe you've overdosed the medication, maybe there was excessive exercise. In case you're too strict with glycemic control. In young children, it's also common, also in case of alcohol intake. What is the quickest remedy? So usually you're advised to take small amounts of sugar or any sugar-containing food quickly, like a snack. It will respond within 10 to 15 minutes. That's why you're encouraged to have always a snack wherever you go. The other 2 complications, usually in most cases, they are because maybe someone has had their body dysfunction, but you didn't realize. So in most cases, they are common in people who have come for the first time, and most especially in type 1, a child with type 1. There are chances that in case of any infections, there are chances that in case he has been in a period of not adhering, they will develop something we call diabetic ketoacidosis. And basically this one, the child will develop, deep rapid breathing, vomiting, may even lose consciousness, and go into coma. So in this case, usually advise that there should be very early referral, because all this child needs is some fluids and some quick insulin. Nearest cell facility and have this done, because this particular thing is very fatal. Then there is the other hyperglycemic hyposmolar state, which is common in type 2, and in most cases it's because of late diagnosis. Now, the other thing you need to be aware of, there are very high chances of blindness. You just need to recognize it when your sight is not as clear as it should be and report it. Because in case of early detection of these visual problems, there are ophthalmologists, the eye specialists who can actually manage it. Kidneys, usually they tend to be affected. That's why in this case we need to do like evaluations, because they are very important tests that are done here that will help to know whether your kidneys are normal or not. This diabetes tends to also affect the nerves. Usually the extremities are what are affected first. So if you start experiencing maybe needle prick sensations in your lower limbs, like below your foot, you also feel pain, or you just no longer feel like you used to feel, out for them and report them. But the other thing I need to also emphasize here is that see, when you lose sensation, there are chances that you'll get injured and you won't notice. That's why we encourage that in this case, make sure on a daily you examine your feet very well. Look at your feet clearly and make sure there is no any ulcer or any wound that has developed over the day, because you may not feel it. These wounds tend to get infected. Remember, there is sugar in blood, and these microorganisms, they like that sugar along the bacteria, so they will come and infect that wound, and now that's how it starts growing and deepening and turns into a very big wound, and it destroys all the tissues. That's how some people end up with amputations, and when it's so worse. I want you to keep yourself in check every day. You look out at your feet, you look and make sure there is not any wound, and then make sure you put on the suitable footwear, because any injury can happen. Maybe moving to the farm without gumboots, so the appropriate wear for any place you go to. Yes, you will notice an ulcer, treat it intensively. There are certain mechanisms that are available to treat it as quick as possible. Then you also discourage bathroom surgery, like using sharp scissors, sharp razor blades to cut hyperkeratosis. You see, you can create a wound that will really grow and expand into something big, unexpected. Then the other thing also we encourage is that still it goes back to adherence. In case of adherence, there are chances that these complications actually not occur, because sometimes you may get impotence, you may get sudden death because of autonomic dysfunction of the heart. So all these things can be avoided in case of glycemic control. There's preventive medication available for that. Aspirin is usually given, but as directed by your physician, not self-medicated. So all these things require you to be attached to a clinic and easy follow-up. So basically, that's all about what goes wrong for one to end up with diabetes, what causes it, and what are the important life adjustments to make even after the diagnosis. Prevention, type 1 is not preventable, unfortunately, but type 2 is preventable by increasing physical activity and making sure that our diet is healthy. The timely medical checkups to make sure that these different ranges, even if it's diabetes, it's pre-diabetes, it's noticed early and then worked on. I hope you find this important, and I hope it helps you to live a better life. Thank you so much for watching. I encourage you to subscribe to the channel, like this video if you find it important, comment, ask your questions. You can share what you're doing. If you're living with diabetes, what are you doing? So that it can guide the other people that could be having the same problem to live. So I give the medical view. Thank you so much.